So I'm Marika Tammeaid from Itla Foundation. Very nice to meet you. And thank you for this deep dive into Buurtzorg story and Buurtzorg thinking, and also covering very interestingly how you have worked preventively in times of COVID. That was really impressive. So we have thousands of people in the audience. I'm sure they are burning of questions, but I have the slight privilege to start, and I'm really enjoying this position. And I think I would like to start by recalling my own visits to Buurtzorg units in Den Haag. I've had that opportunity for a couple of times. Yeah. And I think those memories crystallize something what you said during last hour. I was just discussing with a colleague that some kind of modesty was what could be the word that is describing what we saw. We went to the office. It's a very small office there in very organic way suited to the local village. Met people with sparkle in their eyes about the work, about their clients, really proud of what they are doing. Yeah. And also some people who have been on the same visit, somebody said that, oh, here is nothing to see. And that's actually true, because I think what you impress people by is not about great premises, nice advertisements, super fine process models of care, but you really impress people by human encounter. Mm-hmm. And that's really a paradigm change, I think, at least on 3 levels: in business and in how you look at care in a holistic way, and also in how you look human potential in organizations. Yeah. So after this, I just have to ask you first, how did you got the courage to start something totally different of the expectations? So that's so in so many levels, so profoundly different. Where did that courage come?
Oh, I think it was always there. I think I was always a bit different, but I never had the ambition to start my own company or something, because I thought that after my study economics, I became a nurse, and this nursing profession, that was for me amazing. Just this building relationships every day with people who trust you in what you're doing and give you this very intimate look into their lives and accept things from you as a nurse, which is every day was for me a learning experience. So this was for me so important that I felt doing this for 14 years. I've been working for 14 years as a nurse. I thought this is the thing that I need to take care of. So when I became manager in 10 years after, since 1995 till 2005, I saw the struggle in these organizations, and these nurses, which were a lot of them were friends of mine, said it's getting worse and worse. Mm-hmm. So these organizations are becoming professional, and we have professional departments on IT and financials and so on, HR not to forget, and we have more and more managers, and the way we can take care for our patients is getting worse and worse. So for me, it was by having all these experiences, so being a nurse, but also being a director of innovations, and I also did some projects in other countries. So I was developing primary healthcare in Ukraine, in Odessa, for 4 years. Mm-hmm. I got the opportunity to do some things outside. So my idea was, why shouldn't I build on my own experiences, start something where I believe in? So I believe in professional nurses. I believe in people who want to do good things. And I really believe that we build too much power structures and too much bureaucracy and too much complexity and so on. So my idea was, okay, I have this idea. I have a few friends who have the same mindset with different backgrounds. There's one, my IT friend, Art. And together we said, okay, we're going to design something which is consistent, and we will start a discussion with everybody in the system to explain that this is more sustainable for the future than what we have now. So, and I really was convinced, and that my economical background helped a bit with it, because I said, if we are able to show that this has a significant advantage, if you look at it at the current way we're doing things, also the economical people will see that this is much better. And I really believe that this, the nurses and the patients, they will, in my belief, in my expectations, they would become the carriers of the model. They would talk about it. They would be interviewed on television, and so my idea was, if nurses trust this, if nurses, and it was, I think, because you talk about courage, and I was amazed that so many nurses were having the courage just to start a team in Amsterdam, in Rotterdam, in The Hague, and they just said they with 25 years being at the same organization, from one day to another, they said, from tomorrow we are going to organize our own team, and we are going to take care for patients the way we think is the best way. So the courage is more for the nurses, I think, than for me. For me, it was just an idea that I said, okay, with all the experience I have, this is what I need to do.
Yeah, for me it sounds that you really felt the need, and also that somebody has to do something to get better results, better care, and also better working places.
Yeah, and don't forget that because of this, of course, I had these ideas before, so I struggled a lot with my colleagues in the organization I worked. So I had many conflicts with people because I said we had an organization where we had 18 directors. And I wrote a discussion note, but I said, we have to move from 18 to perhaps 2. We have too many directors. But of course, this was not, this didn't make me very popular with my colleagues.
Yeah. So who were your main allies on the way when you were developing this, and who were those who you struggled most with?
Oh, my idea was from the start, I think there will always people who understand this and will support it, and there will people who are going to fight this. But I will try to find the people who understand it and will support it. So one of, I think, my most important allies was what I already mentioned, the Minister of Health. So Jet Bussemaker at that moment, she was Minister of Health in 2007. And she invited me to the ministry. And she came on a bicycle visiting patients with a nurse.
Wow.
And she wrote about it and she talked about it. And in 2008, I think, there was a big discussion national because all the other organizations were complaining that so many nurses were going to work for Buurtzorg. And there was even a discussion in Parliament. And then this minister stood up and she said, it's up to the patients to choose if they want to have the care for Buurtzorg. So it's that choice. And if Buurtzorg is doing things which the other organizations are not doing, they should learn from it instead of complaining about it. So this is what she said. And we still are friends. So almost 15 years later. And we went together to Cuba in January to learn from the Cuban system about prevention. And this was a very important ally. There was somebody I didn't know personally, but he advised the government. So there is a governmental advice institute. It's called the Raad van State, and the king is the president, but the vice president is somebody who is when there are elections, they are also advising about the coming government. And this person, who was already in the 80s, gave an interview in 2008 in the national newspaper, and it was on the front page. And exactly in the middle, he said, there is happening something interesting in Holland, and it's called buurtzorg. And I thought, this man was an authority for me. So, and I was curious why he said it. At a certain moment, he had an accident and he needed help. And he got help from a buurtzorg team in The Hague.
Wow.
And then they said, you should visit him now. Then you can talk with him about, so when I visited him, I talked with him for 2 hours. And then I said, what made you say this? And he said, we build so rigid and complicated systems, not only in healthcare, but also in education and also in other sectors. And we need examples who can break through these systems.
Yes.
And he said, that's what you're doing. So we should celebrate what you're doing instead of complaining about it, what others were doing. So I got this on different places, high positions, people I even didn't know were supporting the idea. 50% of the health insurers were supportive. The other 50% were fighting. So I said, I focus on the people who are supportive. And bit by bit, we got more allies. The union, because I provoked a bit the union. I said to the union, do you still think that you are supporting your members? Because I think, I'm a member of the union. What I've seen is that the union is talking more and more in management language. The union is talking more and more with managers and people in the top of organizations. Then you are talking with your members. And what I think what's important for members, if you look at a nurse, is that in your daily practice, you have more autonomy, you have more abilities to educate, to train, and what I see is it's getting worse and worse. So you have this national agreements, and it's only about the salary, but it's not about the conditions, and it should be about the working conditions. So the union was supporting me, and elderly organizations, patient organizations. So more and more I found allies everywhere.
It sounds that you have really raised national and international discussion within the branch and also more broadly. So now when you have, you already actually said in your speech that it has not even, or it hasn't been that easy either always with legislation and regulations, because both social and healthcare, they are very regulated professions. So can you tell a bit more how you have overcome those obstacles?
Yes, from the start I said the way we are doing this based on products and production and assessments is not client-centered. So I said, if you look from the perspective of the client, you should think about, okay, how do we know what the client really needs, or the patient, or people who are vulnerable, and how can we focus on outcome? So I made a change from products towards outcome, and a lot of people understood this. So a lot of people thought, okay, that makes sense. So we build a much too rigid system which is focusing on products and on hours and on minutes and on registration and bureaucracy and so on. So I said, okay, the way I dealt with it was I gave an alternative. So I said, if you do it this way, then I expect that the results will be this and this. And what helped was the report of Ernst & Young. So in 2009, they wrote a report, and this report supported the assumptions I had. So this was very helpful. So I thought I'm going to beat the economical people with their own weapons. If they think it should be a financial topic, then I make it a financial topic. Of course, it's a human topic, but in the system we are living in, we need to find ways to argue with financial people. I also argued the legal systems. So I said the law is meant for supporting people, but what we are doing is creating problems for people. It's very difficult in a complex system to find your way. So if you can just by one phone call, just call your community nurse, and she is arranging all these things for you. I think that should be logic for a lot of people. And a lot of people said, okay, yeah, we remember this in the 80s or 90s that we had it, but we lost it. Mm-hmm. Yeah. So I always said we have to go back to the history. Yeah. So we have to learn from the history and the positive and good things from the history and translate them in a modern way to the future.
Yeah, it's like reinventing the truths that have been there. Yeah.
So and in the beginning this was not popular. So it people said, even in interviews and in the newspapers, this is sentimental rubbish. And they said no. So this I think also my age, I was 44, 45 when I started this, was needed to argue this kind of discussions. So I said we will never go away for discussions. Yeah. We just jump into it, we go to explain it, we build relationships, and we will see what happens.
And you have, of course, stunning results to show. So
yeah. That was very helpful.
Yeah. Yes. So now, when taking your holistic approach to care and your interactive and solution-focused approach with the clients and so on, so what kind of and you get new colleagues, a lot of them every year. So what kind of an onboarding you give to your personnel to this approach, which is uniquely Buurtzorg?
It's not we don't do so much on onboarding. It's more, it depends on what's needed. So the needing principle is very important. In the team where people are joining, the team discusses with the new colleague what they need to learn. And sometimes some of them don't need anything, so they just jump in and they learn by doing, and they are part of a process that the first month you learn all the practical things, and then after that you want to learn more and you focus on certain topics. It's a very natural process. And I said there is nobody who has a standard approach. So everybody has an individual approach. And first, like with patients, first you have to learn who is this new colleague? What is their coping strategy? What is their learning ability? And how can we adapt as good as possible with this new person? Yeah. So it should be always a personal approach. So I got many questions about this topic, about shouldn't we have a standardized onboarding process? And then I said, why? Why should we? Everybody is different. And I think it's important that people who are joining Buurtzorg are asking themselves, what do I want to learn? What do I need? So if you start with yourself, and then you can get the support you want. So and we said on every topic on education, there is enough money we can spend on education. That's never a problem. We even are now going to have a budget on everybody is going to create their own health plan. So I said, why shouldn't we focus on staying healthy? So I said last year. So I started a discussion about if everybody is just thinking about how can I stay healthy, and we give everybody a budget. So what do you need for staying healthy? Then perhaps we can avoid a lot of people who get ill. So these things, but then it's important that a reflection, who are you, how do you deal with things, personal development, what do I want to learn, what are one has more spiritual things she want to focus on, the other has more physical things, so everything's good.
Yeah, for me that sounds very, very, very good, really respecting the human diversity and different strengths, and also I liked a lot what you said about every nurse being an innovator.
Yeah.
Because that's how work develops.
Yeah.
So now Buurtzorg has grown really, really big and known and spreading to different, also from elderly care to youth care and many other branches. So how do you see your own role now? How does your typical week as CEO of Buurtzorg look like?
Yesterday I said to my wife, I had phone calls from 6 different countries. So I was talking with somebody from Romania, which was about the trafficking problem. I was talking with somebody in the UK about the NHS. I had a call from Estland, France. I was talking with, and what I'm doing now is trying to inspire people, support people. Or Taiwan, I had also a nice call with Taiwan, with a lady who started just 6 years ago something, and now Taiwan is the most fast-growing Buurtzorg example. And it's funny to see that we created kind of an international family, and that's part of my work. But on the other hand, I'm doing supporting projects in Holland on prevention. I see now prevention for the coming years as one of the main topics. So how can we focus more on staying healthy, on supporting people in healthy behavior and lifestyle, and so and on the other hand, how can we make the daily practice of nurses even more attractive for young people? So these are some of the topics, and it's very diverse. So this evening, I have I'm on television in Holland about what COVID, what the influence of COVID-19 is on society. So and then I'm part of a discussion program. So and then I give my opinion on certain things. So it's not very structured. Every day is different.
Yeah.
And that's what I like.
And sounds it that we are going to get new inventions also. Your creative mind is working.
Obviously.
Yeah. Yuri, do we have some questions there in chat you would like to ask now?
Yes, we do. Well, for the first, I'd like to say that you wrote in your blog about, you kind of ended the blog last week that let's choose humanity over bureaucracy. And I think this was well put, and as you have also kind of shown in this presentation that it can also make sense economically.
Yeah.
But about the questions, there was a question that who is the paying customer, person, public sector, service provider, and you talked about this subject, but how would you describe the collaboration with the paying customers?
In the Dutch system, the payment is done by the health insurance. So the nurse can decide on what is needed for clients. So the client who's insured by one of the health insurance calls the nurse and the patient together talk about what's needed, and we can send the bill to the health insurance. So the health insurance is one of the payers, and we have contracts with all the health insurance about the tariff and about certain conditions. But it's a very easy system. So we have just one person at the back office who's doing the billing for all the health insurers. So it's all electronic and very easy. So it's all integrated in the system. Then we have a more difficult system, which is the law on elderly system. That's for people who are waiting for a nursing home, but are still living at home. That's a bit more difficult system, but there's also, you can compare it with health insurers, but then led by the government. And then the third payment is done by and that's more for the domestic care, by the municipality. And therefore we have an agreement with municipalities with around, I think, 80 different municipalities in Holland. And we also try to standardize this process, but every municipality is a bit different. But still we deal with this 80 municipalities with, I think, 3 or 4 people at the back office. So this is, I don't know exactly if this is the question, but this is our payment system in Holland. And every time again, we try to simplify the payment system. So is this what you...
Yeah, I think so. Thank you.
Yeah, okay.
And the next question is about the decision making. Somebody asked that how are the decisions made that affect several teams or a whole organization? What is the process or mechanism for that when it's not just this team level decision?
Yeah, I think that's a good question. I just had a discussion with somebody who wrote a piece about the decision-free organization, and he called Buurtzorg will probably be the first decision-free organization in the world, because we think we have to make a lot of decisions, but I don't think so. So there are not so many decisions you have to make. So that's so and when it's needed to decide something, it's best, I think, to have a kind of a collective decision. So it depends on the topic. So like what I told about the crisis team for COVID, it was not based on a decision, we have to do this or that. It started to develop organically with some people who were very logic that they should participate in this. I was also part of the crisis team, but I was not in the lead. I was just giving my ideas. And nobody was making decisions. We all said, okay, is this a good idea or not? Perhaps. And sometimes it was this person, sometimes that person. So the whole idea of decision making is not, within Buurtzorg is not a topic. So sometimes they ask me, what do you think about this or that? And then I give my opinion. But then I always say also, if somebody has a better idea, then because others' opinions are as important as mine. There are some responsibilities for compliance and for government rules and so on. And then I have to take my position. But that's just a formal position. It's just for a few things in a year that it's needed. And it's also my role to some of the health insurance, but most of the decisions are based on collective discussions and at the end, a collective decision. the way I would like to answer this question.
Yeah, very, very important points. One more.
Perhaps one more. There were questions about this about the dynamics in the teams, and somebody said that when there's no manager, is it not the strongest ones that kind of decide, and also about this how do you deal with the conflicts, and also about the role of the coaches. Can you describe that a bit more?
Yeah. Yes, it's always funny to say you make the connection with when there is no manager. You also can say what happens when there is a manager, because then you have one dominant person who's making decisions for everybody and who has a lot of influence on the behavior of everybody. Of course, there is a dynamic in teams, and that's a very healthy thing, I think. And I think what's important is that there is always an open discussion about how can we create the best conditions in the team where everybody feels safe to say what is needed. And it's an ongoing process. And the coaches have an important role in that. So they see, for example, there are always, I think, 5% of the teams who are struggling with this. And if the coaches can read these teams, then they can support them and can by doing some interventions or helping them get them to another level in how to solve it. But these patterns, sometimes the team can develop for a long time very well, and then at a certain moment when somebody leaves, they are in a period of struggle. You shouldn't worry about that, because that's also part of life. So it evolves, and at the end they find a way to get out of this situation again. The coaches are very sensitive and service-minded, so they need to have a good feeling about what's happening and not stepping into the role of a manager. So ask questions, but also let them feel that you are concerned and that you are connected with what's going on. So these ideas about how to deal with conflicts, it's different. We say, okay, perhaps the whole team should have a kind of training on how to deal with the topic. A lot of teams, at a certain moment when they have a conflict, they decide to have a kind of a team building thing. Sometimes they also decide, and you should be very clear about it, when it's not working with one of the colleagues, you have to be honest. So then you have to say, this is not working, what are we going to do? So then we say, okay, perhaps it's better to or find another team or find a place outside Buurtzorg. So my idea is that when you have a respectful and open relationship, you can discuss everything. And that's what I, from the start, said that should be the general attitude towards each other. So, for example, yesterday I started a day, once in a few months, I have a meeting with the people at the office. And I said, okay, this is happening in the country, and we are there for supporting the teams. But I said, also ask the question, do the teams still feel that they are supported by everybody at the office? Or in the meantime, did we make some rules which are more or less decreasing the space for the teams? That's happening always in back office roles. So I said, let's evaluate. So this year, the coming months, we are going to evaluate every part. Said, okay, let's talk about it and let's reflect on ourselves, and do we still think that we are doing a good thing? So that works very preventive. And that's also what we ask for teams, evaluate. And about the conflicts, every team meeting should start with the question, how is everybody feeling? So how are we doing together? Are we enjoying this collaboration still, or do we have hesitations with the way we are doing things? And I think that's an ongoing learning process.
Yeah, for me that sounds really like the source of joy of work also.
Yeah.
And really trying to reduce all unnecessary bureaucracy.
Yeah.
So I think that last question, now when Buurtzorgin has been spreading to different countries and different areas, so what are your main learnings of applying this model in other countries?
Well, I think what I already said in the lessons, one of the most important things is that people really want to do this and are really inspired by the good motives. You know, the first years I got a lot of people who said, "Oh, you're growing so fast. It's a very good model," financial people, and they wanted to start something based on the wrong motives. So I said, if you want to improve the healthcare system, if you want to improve the working conditions for nurses, if you want to improve the outcome for patients, that are the right motives. And then, so that's about the vision on healthcare. But then you also need a good idea about how can you build it in a consistent way. So you also have to understand how the financials work, because when it's not going well financially in the first years, then the pressure is getting up. So then people saying, "Oh no, beautiful model, but you can't afford it." So you have to think about a good business model. You have to think about the right people who are doing this and the right motives, and take time. So we take time in the way we are supporting our partners. But if you just have one of these three parts, then I don't think you will succeed easily. So you need this holistic perspective also on the way you want to do this.
Yeah, thank you very much for these valuable insights and in mostly for inspiring us today. So now we really hope that these thoughts and good working place, good care, they spread in also in Finland and in other countries. So thanks a lot, and hopefully we'll meet you again soon.
Still thank you, Marika and Jos and Jyri, and first the audience, such great questions. Eli kiitos mahtavasta puheenvuorosta Josille ja todella monipuolisia näkökulmia, ja koko ajan itse vaan nyökytteli tuolla yleisössä, kun kuunteli tätä keskustelua ja puheenvuoroa. Meillä ei tänään ole ollenkaan taukoa, joten kehotan kaikkia siellä ruudun toisella puolella nousemaan paikaltaan ja vähän venyttelemään, stretsaamaan lihaksia, että ei puuduta. Vaikka asia on niin kuin järjellisesti varmasti inspiroivaa, niin kannattaa myös siitä fysiikasta pitää huolta. Nyt seuraavaksi siirrymme siis seuraavan vähän yli tunnin ajaksi kuulemaan siitä, mitä itse ja yhdessäohjautuvuus Suomessa oikein tarkoittaa, mitä kaikkia esimerkkejä siitä muun muassa näiden seuraavan 3 puheenvuoron aikana on Suomessa tehty. Eli ensimmäisenä kuullaan moniammatillista ryhmästä, kokeilusta pysyväksi toimintatavaksi, kokemuksia ja ulottuvuuksia itseohjautuvuudesta Anne Isoniemeltä. Hänen jälkeensä siirrytään johtajuuden maailmaan, eli johtajuuden muutos toiminnan johtamisesta kohti ajattelun johtamista. Kati Toikka, kehittämispäällikkö ja muutoskuiskaaja Järvenpäästä. Ja viimeisenä tosiaan yksilöllinen ja yhteisöllinen työn tuunaaminen. Mitä tämä oikein tarkoittaa? Yhtä lailla siis itseohjautuvien kuin itseohjautumattomien organisaatioiden voimavara. Ja tämä puheenvuoron pitää Jari Hakanen, tutkimusprofessori Työterveyslaitokselta. Mutta nyt ihan ensimmäisenä annetaan puheenvuoro Anne Isoniemelle, etuuskäsittelypäällikkö Kelasta. Olepa hyvä.